without any further ado, let's dig into it. Let's get started. So I would like to invite Winette to please talk to us about why adolescents and young adults are special. We know that they are special, but from a clinical and medical point of view, please tell us.
We really need more early holistic care and interventions because they may prevent later what I call health consumption, but I mean that people don't need to go to the psychologist. Maybe if you have had good care from the beginning. And it's important to realize with a long life ahead, a good survival, that treatment of today may have lifelong impact and risk and consequences. Focus on fertility, education, work, romantic relationship, life insurance, mortgage after this treatment, and late effect of cancer. And altogether, they have these topics, as you can see here.
So this work is really a culmination of 2 years, and I cannot believe we're already here. It's been a lot of things back and forth, and one thing that we really managed to do here was to put patients in the driving seat. So the paper that resulted from this work has 5 main components, which are listed here.
And we came with a series of key takeaways from a in-depth and detailed discussion and debate.
The experience of the young people in the peer visits, also the general report of the peer visits and of the round table. It's available on withcancer.eu, so you can read there the reports.
So I first enrolled as a participant, as a patient advocate, a personal lived experience to just broaden my horizon, to see how everything works in different countries and get inspired by other systems, and also just meet other people from different backgrounds, what their life's like, what cancer is like for them in their environment.
I mean, we just had a very good federal minister of health who implemented cancer care centers in Belgium. So there are 6 university hospitals who will be responsible for providing AYA care in Belgium.
The doctors are all very aware and specialized, and not only doctors, because we do provide a holistic care as much as possible. They are specialized to take care of also AYA needs.
For all of us. So it's been very interesting and very nice to meet all of you and to feel that there's people outside there that really care and really want to do a change.
Looking at the slide results here, actually, I think we are in a very good place with the recommendations.
To be dedicated for teamwork with AWAs and healthcare professionals, close co-participation, facilitates the movement and supporting the team, starting a movement and seeking your first followers.
A big difference in education, how education is delivered to healthcare professionals, if there even is access to healthcare professionals' education, and especially education will be key for enhancing services also for AYA. So therefore, I think it's very important as national societies and international societies, we stay lobbying with this great work, because this is also will become a great tool to lobby and to go to policymakers also in Europe. And for example, with the European Oncology Nursing Society, we have already for a long time, we have an educational framework that we want to adapt in the national societies, but also in the member states of Europe. But this is very difficult, but this will create opportunities for education, access to education, and we need to put these recommendations into these educational frameworks for different healthcare professionals and lobby with us and the implementation. So Europe has an assignment, I would say now, to put this in their educational frameworks and put it through to the national member states to enhance the education of healthcare professionals, to increase the quality of care for AYAs.
Here we are. This is the first part of our recommendations. So this new white paper that we are about to publish with the recommendations for the minimum clinical standards of care for adolescents and young adults with cancer come with a checklist and then with a roadmap, a toolkit for healthcare providers and for researchers and for patient communities to strive for more equity, diversity, and inclusion in their practice. So on to you and to the implementation roadmap.
So for the implementation roadmap, we give some advices on how some of the checklists should be implemented.
I think we can work together through NTIAC and other initiatives, and I think we can be very influential in the JANE, Joint Action for Networks of Expertise, which are going to, we hope and expect, be delivered across Europe. I think by being a strong European group together, we can contribute to global initiatives, of which there's one in much discussion at the moment.
Amazing celebration and a very, very big milestone. Thank you, everyone.